Hey YouTube, this is my first appearance here, and my name is Autumn. This is going to be the start of my Accutane journals, and I guess I'll just show you my face up close. All right there, sorry, this is backwards for me. Right there, on my chin. Underneath my chin. That is like something from a cyst. It's a scar. Hopefully Accutane can get rid of that. It's like kind of hard, so I don't know if there's still stuff in it, but and then in my hairline kind of. On my forehead, I have one right here. Right there. You can see him. But that's my face. I have gone to a dermatologist before for my skin, and they put me on like Tazarac, which is like the strongest steroid cream you could use. I've done numerous antibiotics, so that hasn't helped. It did for a little bit, but then like my skin just keeps coming back. This is the worst that it's been. It started after I ended my job at the pool. Like the chemicals were all messed up all summer, and that's kind of what started like around here. And and then I got sick for a month and a half, like continuously. The doctor thought I had a staph infection, and so they put me on Bactrim, and that helped a little bit, but now I'm off of it. This is kind of easy to cover up with makeup and stuff. Like, I don't go out looking like this. I'm not ashamed of it. It's just I'm so self-conscious with my face looking like this, so it's whatever. So yeah, I start my Accutane on the 16th of January, or that's when I have my second pregnancy test and stuff like that. But that's when I get the actual medicine, and that is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 19 days away. That sounds like a lot now that I count it out, but I'm super excited for it. I have to go get my blood work done and stuff for it as well. But yeah, so that's my face, and I hope I can, help you out if you continue watching. A little about Accutane. People make it sound like a worse drug than it is, and now there are new things that's saying it's like linked to Crohn's disease and something else. I'm not quite sure. I wasn't really worried about that one because the Crohn's one I was more so worried about because my mom and my aunt both have it. So I'm like at a higher risk as it is, but now being put on Accutane with the accusations of it causing Crohn's. But I mean, this is like my last resort. I do not recommend this drug for people who have like mild acne. I mean, you guys may think that this is mild, but literally, I do not have a day where my face is clear. My face hurts. It scars really easily. They're not really pimples. It's really weird. But anyway, back to Accutane. It like shrinks your oil glands, so your face doesn't produce that much oil anymore, causing your face to have less acne. They say that this is a permanent fix, but some people have to go back on it like during hormonal changes, like usually women. And I have a feeling that I may have to go back on it because like my body's just a spaz. But treatment usually lasts 5 to 6 months. I've heard people that go on for 8 to 9. It just depends on your body. So I'll have to see, how many milligrams I can start out with now, and then how many milligrams I can, bump it up each month and see how my body takes it. But, so yeah, I already got my stuff for it, like all my facial stuff, because I'm so excited. I'll be right back, and I'll go get this stuff really quick. Okay, sorry about that. So, I got a couple things. The first major is chapstick. I am going to be using multiple different kinds. I'll just have one with me all the time. You always need chapstick. I've heard that people's lips have been cracked. I just can't deal with chapped lips. So I'm going to try to prevent and keep them as moisturized as I possibly can. I got Vaseline. This is like to lube up at night, just to keep everything, moisturized, your nose and stuff. Basically, I'm just covering all the bases. I watched a lot of these, so I'm just kind of like, making sure I have everything. The Aquaphor, heard it's really awesome for your lips. I also use this for my tattoo, and it works wonders. Yeah, and it's advanced therapy, so you can lather up at night. Again, Cetaphil moisturizing cream for dry, sensitive skin. This is great, I've heard. I'll actually tell you who I heard it from really fast. Hold on, let me look it up. I watched all of his movies. Chris LAX16. Now he is, like 2 years off of Accutane. His face looks awesome. He had like 1 or 2 pimples, but compared to like what his face was and like what mine is, I'm totally okay with having 1 or 2 pimples. So yeah, that. And then I just got a little one, throw in my bag, just, to have. And then this, I've heard 5 people really like this, so I'm getting used to it. Purpose, and it has SPF, which you need, especially on Accutane, by Johnson & Johnson, so it's really nice. Yeah, I have to ask my dermatologist what kind of face wash I can use, because I heard Cetaphil face wash is like really awesome, but then I also heard it could dry you out more. So I need to check on that, because if it doesn't dry you out, then I'm definitely going to get it so I can keep like within the Cetaphil family. And I just always want to try it. I heard it helps like a lot with your acne and stuff. So I heard that there are initial breakouts every time you bump up your milligrams. Not looking forward to that, but in the end, I guess it's like much better. We'll see my journey, if I'm ready to get off of it or not. I'm pretty sure I will be, but I'm so excited. One thing that I'm going to have to get used to is drinking lots of water. I don't drink like at all, like anything. I'll have like a 24-ounce water bottle or whatever, and I'll drink maybe, okay, so if it's this big, I'll drink maybe like that much of it a day. And then I'll have like whatever I drink with my dinner and stuff. Like, I do not drink at all. So that's probably already like why it's kind of nasty sometimes. But I'm definitely going to have to get used to that, because Accutane like takes all of your moisture, water out of your body from your joints and all of that stuff. So you need to be drinking what you can replenish, so you can replenish it. But yeah, I think that's about it. I'll talk to you after I get my blood work done. That'll be like the 10th or 11th, so that'll be like a week before I start Accutane. Then I'll unwrap or unpackage my Accutane to see what kind it is, if it's like Row Accutane or Clarex or something like that. I don't know which one I'm on yet. And then I'll do probably like a week or two update. Like I'll do one a week on Accutane because that's such a big drug. We'll see, how it goes. And then I will probably do one upload video every 2 weeks because that should give it enough time to like see what's actually going on with my skin. Just so you know, I have been a sufferer of chest knee. I'm doing pretty well. I mean, those are just like, healing. And I have back knee. I'm not going to show you that because then I'd have to. It's gotten better as I've aged, but hopefully with Accutane, it'll, get better with that too. So I will see you the 10th or the 11th. I hope this is helpful for you guys. Bye.